The good news is that cancer is no longer a no-no in our profession. So it's no longer a contraindication as long as you have a relevant amount of information to hand and you know how to work with somebody and you've done all the correct modifications and you've taken a full case history and you know and understand what it is that you have to do in order to be an effective partner in this. 1 in 3 people will get cancer in their lifetimes. And you've probably already had people around you who have experienced this. So in order to work safely, we need knowledge, and training is essential. So the potential benefits of what we can as massage therapists offer is some things like hope, which is a major thing. You know, when you're first diagnosed with this, hope is a big element in which we can have an effect. You can offer your client control. They will feel less isolated. It has also been shown to improve effectiveness of medication, physical therapy, and medical procedures. Also, another big component is pain relief. It also decreases the chemo and radiotherapy symptomology. So some of the things like the nausea and the headaches, we can diminish some of those symptomology. And also another thing that happens is the recovery from the anesthesia, and that can be quite strong. Now, these are only just a few of the potential benefits of body work. There are a lot more, but this is just to give you a taster of what can happen. So further considerations that are important is their current health. So what happened, what were they doing up to this point in their life before they were diagnosed? What's their general lifestyle and health at this point now that they have been diagnosed? What form of cancer have they got? What's their current treatment? So are they going for chemotherapy? Are they just doing some general palliative care? What is that? That will help to determine our goals. Also the timing in which their therapy is taking place. So in other words, if they're far along into the chemotherapy, you might find that you have to change your techniques, or you might not be able to work with them at this point. So the aim is to offer some support within your therapy to ease the symptoms of either the treatment or the diseases. Less is more. So in this, quite often people will come with a preconceived idea of what massage they've had in the past. Should that be the same in this case? And the answer is more than likely no. There are things that need to change. So your considerations and modifications are going to be things like your positioning, your pressure, your speed, your length of time, your location, and your techniques. This is all dependent on whether they've got lines, you know, for the chemotherapy, where they've had it, have they had any surgery, what kind of conventional medication have they had, what is their condition at this time. All of these things are going to change. What we have finally to offer is that we are going to lessen what we do. Our techniques are probably going to be softer and more general and more rhythmical, and really it's more about having a good listening ear rather than doing something to somebody, being there and being reflective and able to respond to their needs. In the end, what I would recommend for you is to get yourself into a course. It's just if you have lack of knowledge, then you've got to get the information in order to deliver the appropriate massage.